Hi, my name is Randy Dreyer. I'm an orthopedic spine surgeon in Austin, Texas. I have a practice called the Central Texas Spine Institute. Back when I was going to school many years ago, I decided that I wanted to go into a job or a profession where I could take care of people. I like using my hands. I like the sciences. And I chose to go into something where I could help people with pain and help them if they needed a reconstruction. I've been instrumental in working with various companies in the industries that are making implants for spinal surgery in helping them with intellectual property. I've developed some things that have resulted in patents. We've made a lot of new technological advances. I've helped design several different types of screws, rods, plates, and cages. I've worked with the largest and some of the smallest companies in the industry. My interaction with the engineers and executives at these companies has taught me a lot. It's taught me about the biomaterials that are most compatible with human spinal surgery, from metals to plastics to glass and different kinds of chemicals that help stimulate bone growth. We're currently using a lot of stem cells. Stem cells can be derived from the patient's own bone or bone marrow, fat, and other tissues. All of these have resulted in numerous publications. I've given many lectures nationally and internationally through the North American Spine Society, Cervical Spine Research Society, and multiple other organizations. My lectures have taken me to England and all over Canada and the United States. I've traveled as far as Brazil to study with some of the world's leading experts to learn new techniques. And through that, I can bring it back to Austin and use these new technical advances to help my patients. One of the things that's been most gratifying for me is my ability to work with first responders. Since I got out of the Air Force, I had the good fortune to early in my career take care of several Austin firefighters and Austin police officers. Through that, I've had the good fortune, I guess through just luck, to become friends with many of these people. And I've started an interesting collection of patches. The patches that are worn on the uniforms of first responders, whether they're helicopter pilots, firemen, policemen, EMTs, people in the Army, Air Force, Marines, and all over the world. So as I've become friends with them, they've given me patches off their uniforms. And I've framed them and put them in my office. And boy, does it generate a lot of discussion. I truly believe it's an honor for me to take care of first responders. And I've taken care of people that have been first responders from all over the world. I'll have a chance to show you these patch collections as we go through a tour of the office. In addition, as you can tell, I'm kind of a collector. I've saved and been given models by many of the companies that make implants. These acrylic models demonstrate many of the implants that are used in spinal surgery, and I'm proud to say that it's probably one of the larger collections you'll see anywhere except a business fair or a large spinal meeting. So, my name is Randy Dreyer. I'm with the Central Texas Spine Institute. Our philosophy is to provide the highest quality care to every patient, no matter who they are, where they come from. Our goal is to try and diagnose and treat your pain. We try to do it with the least invasive technique that we can think of. We use all non-surgical modalities, including injections, and I do my own. And then if the patient does need surgery, it's always their choice. Unless someone's dying or becoming paralyzed, it's not an emergency. And we tell the patient what their choices are so that they can go home and discuss it with their family and really give it a good thought. If they come back and they say, yes, Dr. Dreyer, I want to go forward, we explain all of the benefits, complications, and risks, and what they need to know to make a full informed consent and decision. I believe it's the patient's right and their responsibility to make the decision for themselves. I'm here to answer your questions, give you the most information that I can.